Hey friends, I'm Leslie.
Hey guys, I'm Marianne.
And I'm Angie. Together, we are the therapists of Eden Therapy Co., and we are inviting you to have a seat at Eden's table.
Coming to you live from Miami, we believe in healing hearts, shining the light, and bridging the gap in mental health. Come sit with us as we learn, laugh, and explore how faith and mental health collide. Hey guys!
Hi!
We're so excited to be back today. Why are we so excited?
We have our first guest!
Dr. Getty.
Thank you.
So before we begin, I want to make sure that we tell you a little bit about Dr. Gettings. So she is Dr. Gettings, and she is a physician specializing in neuropsychiatric health and brain optimization. She is a strong advocate for screening individuals for traumatic brain injuries, particularly mild TBIs, when they present as symptoms often labeled as anxiety, depression, mood instability, or ADHD. She works to normalize the neuropsychiatric effects of brain injury, emphasizing the sequelae extend far beyond seizures, paralysis, or headaches. As both a physician and survivor of domestic violence, one of the leading causes of brain injury, Dr. Gettings is passionate about reducing stigma, improving health literacy, and expanding access to brain-based care for underserved and overlooked populations.
Amazing.
Thank you. Thank you. I'm so happy to be here and to share in this space with you all.
We're so happy you're here.
Yes, we're grateful.
So why don't you kick us off by telling us, when we reached out to you, we're like, we really would love to have you on this podcast. You said, I want to talk about brain injury, traumatic brain injuries. How
Yes.
come?
I would say hugely in part because it has been a large focus of my clinical work lately. I am a spec partner at Amen Clinics, as you mentioned, and so Dr. Daniel Amen, the founder of Amen Clinics, did one of the largest studies on brain injury as it pertains to professional athletes. And so I've had the honor to work with a lot of retired athletes that unfortunately are presenting with symptoms that are secondary to concussions, what we call chronic traumatic encephalopathy, and we need more education around that. So I am the healthy and lit doctor. I'm real big on health literacy, so keeping it healthy and lit. And also, I, as you mentioned, am a survivor of several mild TBIs, but they recently did name domestic violence as one of the leading causes of mild traumatic brain injuries. And so there was a big kind of announcement or publication through NPR about that. And that is also part of my story as well. So it is an area that I'm passionate about personally and professionally, for sure.
That's awesome.
Idea.
Yeah.
I honestly, many people probably have no idea.
Yeah.
Violence is one of the leading causes to that.
Yeah.
I mean, it makes
is.
sense.
It makes
though,
all the
right?
sense.
Yeah.
You think contact sports, you think domestic violence, blast injuries in the military, huge advocate for our veterans.
Let's go.
And falls. So another one that kind of gets missed, and I jokingly tell clients, I'm also a forceps delivery. So one of the things that I
Wow.
Like when they suck the baby out, or when they used to like clamp the baby out.
Correct. So they now suck the baby out. We use these suction devices that kind of plants on the crown. But back in the early 80s, without dating myself too much, they were using a nice little metal device that clamped on the both sides of your head.
Crazy.
And I have pictures of my birth that my father took. And this man was pulling
Oh my God, no.
like this.
I'm sorry.
Okay? So,
But let's also talk about like sometimes suctions are needed because the baby is not coming out.
Yeah, we understand.
okay? God bless my mom and her ministry. Okay? They definitely, I don't think it was an intervention that wasn't needed. And you're absolutely right. If a baby is not presenting in the way that they can safely get the baby out without using instrumentation, you got to use it. It's definitely something that causes brain injury. I actually have a friend whose son was delivered emergently, similarly, and he has seizures now because of he ended up having a brain bleed because of the force. That
Yeah.
was, yeah.
Yeah, the reason why I said that is because I'm sure that there's a lot of moms that are pregnant, and when they go to the hospital in the middle of the delivery and they're like, we have to bring your baby out in a different way. And
Yes.
they might be like, no.
Well, now they're not using, ladies, they're not using metal thongs, okay?
Which
We
is
got,
good.
we got evolved technology that's not just
Thank
pressing
God.
into
Yeah.
those temporal lobes. And that'll be a huge part of just what I want to share
Yeah.
is where you're exerting that force.
Yeah.
Okay, but we
There's a lot
gotta
Let's
take it back
backtrack.
for a second.
Yeah, okay.
So, what is a traumatic brain injury? Like, why is this so important to talk about?
Okay, so let's just make it simple.
Yes.
Trauma to the brain.
Nice.
Physical trauma that resulted in an injured piece of body tissue.
So if I hit my head against a cabinet really, really hard, could that be a TBI?
A mild.
Okay.
So you want to
Oh,
break
damn.
it mild, moderate,
I'll be doing that
severe.
a lot.
Okay. So think a hit to the head that oftentimes will present with certain symptoms, but there's one misnomer, which is you have to have loss of consciousness for something to qualify as a mild TBI.
Okay, so
That is
you
not
don't
true.
have to have a loss
No.
of consciousness
No.
to have a TBI.
90% of concussions, there's no loss of consciousness. And a mild TBI, even if you do have loss of consciousness, it's less than 30 minutes. So
So-
think 0 to 30 minutes.
So a lot of the sports that kids play nowadays, they have TBIs. If I think of soccer, if I think of football, if I think
Yeah.
of cheerleading,
Gymnastics.
wrestling,
Check.
even
Check.
gymnastics.
Check.
Wow.
Wow.
And think you don't even have to hit your head. Now, this is when it really gets.
Oh gosh.
What?
You don't have to hit your head. Your brain is mostly fat. It's about dry weight, 60% fat, very soft, the consistency of soft butter. And it does like this inside of this hard shell. It's rocking. So just think,
Marianne.
I want to live
It's a my piece of theory. I'm looking at it. It's like,
Well, I'm looking
And I
at
like my
looking at
brain model. I
you,
should have
Marianne.
brought my brain model.
fine.
You're like, uh-oh.
But just think, if you're sitting at a red light and a car comes in, bam, you didn't hit your head on anything. Well, you
gosh.
kind of did on the inside of your skull because your brain rocked when you did like that. So think whiplash. You're not actually hitting your head on an external object, but your brain
is whiplashing.
inside.
Which, funny enough, is what I was talking to you about before. One of my clients just recently got into a car accident.
See?
And that's exactly what happened. She now has a concussion.
See?
Wow.
Kind of experiencing the after effects. Which my question is like, what are the symptoms?
Correct.
Like, what should we?
What should we be looking at?
Yeah.
Yes. So when you think about why do we even develop unconsciousness? It's like your brain's protective shutdown. Like, boo, we're working on something else. We don't have time for the science right now. Okay. We're fixing something here. You take a break. Okay. So that's the unconsciousness. But bottom line, the symptoms, that's one major one. Think headaches, think light sensitivity, sound sensitivity, mood changes. This is where your anatomy becomes key. Where did you hit your head? Did you drop something on the top of your head when you're in the accident? Did you hit the frontal lobe or the back? Let's just make it simple. The front, the back. What do they do? So your frontal lobe is the CEO.
Right?
Yeah.
That's like, we're up, we're ready, we're planning, we're focused, we're motivated.
Yeah.
Well, people who have concussions, especially shortly thereafter, their focus is not there. They have brain fog, they have headaches, they just don't feel as sharp. Okay. Then when you think of the back, what does the back of your brain?
Your occipital lobe.
There you go, girl. Let's bring on the big medical terms. Occipital lobe, vision.
Your vision. Yeah.
Your vision. So and also underneath the occipital is the cerebellum.
Yeah.
That is all balance. Middle ear, inner ear. Am I falling or are you falling? Am I moving? Is the room spinning? I don't know. So vestibular assessment, or what we call vestibular symptoms, you want to think the cerebellum. That is where we get all of our coordination and turn this way, that way, and not feel like the whole room is spinning. So if you just have a hit that affects frontal lobe and the back, your key players in terms of symptoms, brain fog, light sensitivity, vestibular symptoms, balance, headaches, think of those things. I think when people hear traumatic brain injury,
Yeah.
they think somebody bleeding.
Right. It got to be traumatic.
Right. You don't have to bleed to have had a trauma.
That's
So
interesting.
I also have a client that had a TBI. They worked at a fashion company.
Okay.
And there was a rolling rack that was misplaced in a place, and she went smack into it in her frontal lobe. And till today, she has problems with light sensitivity, tiredness, and brain fog. And that is so common. And as a therapist, I think we miss it so many times that it could be this,
Correct.
right? So what should we as therapists be looking out for as far as like if our client has had some kind of brain trauma, like how should we adjust our treatment plan? Like what should we do? What should we start recommending?
First things first, history. Key. You always want to start with a great history, because a person may come to you and say, I'm feeling anxious for no reason, or I'm having low motivation, or I'm feeling depressed. What is their history? Start from before birth, okay?
Oh, wow.
Your parents' genetic loading matters, all right? So just think there. Anytime, I'm just talking about a full, thorough assessment, but if
Right.
we're really looking at, does this person have an underlying physical injury to the brain? Oftentimes, they're not going to report that.
Right.
You have to ask. So it is the history taking. Have you ever hit your head? And I say to a person like, have you ever had a brain injury? 9 times out of 10 people, no. Okay, well, so you never been in a car accident? Did you ever play sports? Have you ever been in a fight? Like, these are the ways that you need to ask it, because otherwise, their conception of a traumatic brain injury, they're probably going to tell you no.
Yeah.
And if you understand that the brain isn't separate from our psychological presentations, then that has to be a huge check box where
Yeah.
you say, well, I know this person is depressed, but I have ruled out any underlying causes that include past brain injury.
Yeah.
And you'll be surprised, just going back over history, what people would, you know what? Sometimes I'll tell people if I'm looking at their brain and I see the image and I'm like, what happened? You tripped. Somebody drop your hand. Call your mama.
Call your mom and find out.
You know, like, because you may not know. So I have had cases where a person reports on their intake, no history of head injury, but their scan shows evidence of injured brain tissue.
So again, like, wait, let's take it back. What is a scan? And what
Yes.
scan are you talking about?
Great question, because your client, I'm sure, went to the ER like most people do, and they get what we call a structural scan. So a structural scan is going to show you evidence of a more severe traumatic brain injury, which oftentimes is not what a person's presenting with. So they go in, they get the head CT without contrast. You're fine. Everything looks great. Probably have a mild concussion. We want you to get rest. Don't overexert yourself. Drink plenty of fluids. Okay. And we're going to give you some pain meds in case you got a headache, blah, blah, blah. And we're going to give you a whole little concussion protocol. But I'm not able to visualize in an ER with a structural scan anything functional.
Okay.
I can't tell you, your frontal lobe looking a little sleepy. No, I can't tell you that. I can tell you you're not bleeding and we don't need to call the neurosurgeon. Congratulations. You won't be getting your skull saw open today. So that said, MRI, CT scan, all you all need to remember is you've got structural imaging and functional imaging. And functional imaging is not required for the evaluation in Western medicine of hitting your head.
Wow.
So basically, if you don't show a fractured skull, a massive bleed, you're fine.
So I worked with a client who played football for the majority of his life.
Okay.
And he was presenting with a lot of anger issues. And no matter how many tools we gave him, it was not working.
I bet.
Right. But whenever I would say, I really think you should get a SPECT scan, he would say, no. I don't want to know. I don't want to see. How do you deal with something like that when you know that your client might benefit from seeing, okay, like I've played football all my life. There may be an issue here.
Yes.
Yeah.
You're a provider and you're saying, this is what might help you. And they're like, no.
Well, I have to start with what is the cause of the resistance. Please explain to me les résistance. Because if you broke your toe and I said, I think you need an x-ray, are you going to say, no, I don't want to see that broken toe? So what is the reason why the person doesn't want to see? And what I do also, while they kind of explain that, is I explain the benefits of a functional CT over a structural CT. So SPECT, which is the type of imaging that I do, is a functional imaging tool. It ends in CT. Look at that, just like CT. But instead, we're able to see brain activity. We're able to see blood flow. Okay, that's key if I'm looking at injury, because people who've had mild TBIs or repeat concussions, like some professional athletes, don't forget your surfers, don't forget your volleyball players, don't forget your soccer, hockey. I mean, it's not just American football.
We're all in trouble.
Come on, okay? I mean, playgrounds. I fell a couple times outside of Chicago.
Oh my gosh.
Trying to flip and be a gymnast, okay? So
And those playgrounds were like
not the same. Not the same.
as it is today.
We didn't have the green carpet. Okay?
No,
Yeah.
and we didn't have the foam.
The little cushion floor.
No cushion.
Iron and cement, baby.
Exactly. So if you just think of going back to anatomy, we covered the front, we covered the back. What's on the side? What's behind the temples? The part of your brain that's called the temporal lobe. And so if you think of, bam, hitting your head in the front, yeah, it's kind of, I don't have to explain to you how you could hit the frontal lobe, but behind the temples, they're sitting there too, facing forward, and they're also on the floor of your skull. So when they rock, they hit two bones that stick up from the floor of our skull. And that causes a lot of injury. So when you think about those repeat hits professionally, it's the temporals that cause the more, I'm not gonna say more concerning, like it is concerning if you can't focus long enough to get things done or be productive. But when you talk about emotions, temper, so I think temporal, because what is there?
Good.
The amygdala.
Right.
The amygdala runs our whole
Emotional
limbic
center.
move, all the things. So if you keep slamming up against your amygdala, she might start wilding out. And that is what happens when you see people who all of a sudden I just have no temper control. I just, everything is just, you're so irritated. And you can see it on a scan that is a functional scan. You'll never see it on a structural MRI or in your ER getting a structural CT scan. So guess what else is in the temporal? Your hard drive.
So like your memory.
Yes, ma'am. Hippocampus. Hippocampus is the hard drive. So you have angry people predisposed to dementia. So what we gonna do?
I didn't even think of that.
We gotta fix that.
Brain injuries increase your risk of dementia by a lot. Yes. So think scar tissue. Scar tissue. It's been injured. You didn't do anything to fix it. You think it's firing the same as someone who didn't have that injury? Probably not. So if you got the amygdala and the hippocampus in the temporals, think about when people have a concussion. What they say? What happened?
I don't remember.
I don't remember. So I was on the field and y'all took me out. Run the tape. Okay. They don't remember because you now are talking about amnesia, which is a clear sign that you've injured your temporal lobe. Because there's your hard drive and the front. So think you're taking in information. The memory is first developing here, frontal lobe. And we got to transfer it to the hard drive. That whole circuit is glitching. And now you're glitching. We glitching.
So what do we do?
Yes. Great question. First, avoid injuries. Like the plague, or like your brain depended on it, because it actually does. So we want to do everything to educate about brain injuries and ways in which we can avoid sustaining them. If you have sustained one, you want to get imaging that can actually tell you the degree of the injury that you sustained. And then you want to give them a great protocol for brain health and healing.
Right.
That's the magic sauce. That's where I come in.
Love it.
Before we get to that, I wanted
Yeah.
to ask you, okay, so a client comes in and they've had trauma, let's say sexual trauma or some kind of trauma, and they have like ADHD, or they report that like they don't remember what happened. So tell me a little bit how your brain health can help if you optimize your brain. And as a clinician, like how am I supposed to know how much of it was trauma? How much of it is that maybe they had a concussion or something, or you mentioned domestic violence. Maybe they were in a domestic violence situation, right? And that's the trauma that we're going to work on. So how does a clinician sitting with a client doing an intake, I mean, we ask, have you had a seizure? Have you ever fallen? Have you ever hit your head? Like that's part of our intake.
Right.
But how do we start discerning like which way we need to go?
Yeah.
Well, you know, in medicine, we have the term poor historian. Okay. If a person, for whatever reason, like let's just say someone grew up in a very traumatic environment and developing the symptom of disassociation or checking out became protective, they may not be the best historian.
Right.
And if you know that they were in an abusive environment, well, abuse travels with other abuse.
Yeah.
So you can screen as much as you can, but I look at it as a physician, just like taking a history about any other part of the body. If I'm interviewing someone about their heart and I'm asking about their nutrition, or have they had chest pain, or do they do things that are unhealthy for the heart, I'm going to take part of that data and take it as face value. And I'm also going to get data that is irrefutable, which would be a picture or some type of image. So for me, it's like, the field of psychiatry needs a huge overhaul.
Yeah.
Because we were trained to not look at the organ that we treat.
Right.
And the problem is there's no other organ in Western medicine that we do that with.
Right.
Period. We don't tell it, well, how's your kidneys feeling today? They feeling all right? Okay. No, you're gonna do blood chemistry. You're going to evaluate the person's kidneys. Yes, they're gonna tell you, well, I'm not feeling any pain in my back, and my urine looks fine. It's not yellow, it's clear, or whatever. But I'm not just gonna solely rely on that. So you're missing a huge part if you don't get data that is irrefutable and is just based on that person's own recollection.
Yeah.
Right.
Because if they have had a brain injury, they might not remember.
Yeah. So I have a question. If somebody suffers a mild TBI like when they're younger, how long do symptoms appear for? Like, could that still be presenting as an adult, or is it like it'll subside on its own?
For sure. So again, we would need to know what was injured. Is there evidence that there still is injury? So if you sustain an injury young, there are different symptoms that could present acutely or chronically.
Oh, wow. Okay.
I would say a big red flag would be anybody you're treating that has headaches. If they're telling, well, I get headaches. Oh, how often? Can you describe them? How do they present? How long have you had headaches? Did it happen after any type of a accident? And asking again, unapologetically, because there's different ways that you could present that question where you jog that person's memory, or they have an aha moment, like, you know what? My sister did drop kick me off the bed one time when we were 12. You know what I mean? Like, seriously, you just, sometimes certain things aren't registering. So you have to get that history. But acutely, it's kind of what we already talked about: brain fog, light sensitivity, sound sensitivity. But chronically, it can be mild headaches. It can be changes in your processing speed. That's another element of a workup that I do with imaging. It's imaging coupled with actual psychometrics, if you will, or cognitive metrics.
Yeah.
So we're testing your processing speed. Think of it as like a computer. How fast is your computer taking in information and responding to you? When you have head injuries that are older and you've lived with them, it can show up on things like lower cognitive processing speed. It can show up on memory tasks. Frontal lobe, you want to look at working memory, short-term memory. Temporals, you want to look at long-term. So we test all of that and see where you score in comparison to same age normals.
Yeah.
So
Wow.
a lot of it is hard to know if you don't do the measures.
Yeah.
So
So, as a psychiatrist, you work with a lot of people, and I'm sure that sometimes there is medication that's needed.
Yes.
Right? But if you have a TBI, does medication always work?
So people who've had mild traumatic brain injuries, another clinical thing to note, oftentimes they don't respond the same to medications. So when it comes to one of the commonly presenting symptoms, depression, depression can stem from the temporals, going back to the amygdala. We also have our limbic system, where more classic depression can present. Well, for the limbic area, we tend to use serotonergic medications. Probably not your best option. If a person is actually presenting with depression coming from the temporals, you want to use more of mood stabilizers. So a lot of times they may be more treatment resistant, especially if they've gone to a doctor who's never looked at their brain or their temporal lobes, and they're like, try Prozac. That didn't work. Zoloft. They didn't work either. Lexapro. So that's so and on and on. And you continue to use the same class of medicine because you don't even know where these symptoms are coming from.
Yeah.
So yes, medication can be huge in helping with irritability, memory, helping with more mood regulation, I would say, and irritability becomes temper, going back to temper. And that depression can also be a bit more severe in the sense where you can have more intrusive thoughts. I kind of think of it as like the frontal lobe being triggered. So you're impulsive, you're more impulsive, less brakes, more gas. And then the temporals are dysregulated. So you're more likely to, that's how I look at that. Okay. So mood stabilizer. So I think first, lithium. Don't get scared now. Lithium, the supplement. Lithium orotate, which is actually really good for all of us neurologically. Not the prescription strength, but I usually will start there with just 10 milligrams or 20 per day. It can make a world of difference. On scans, functional scans, I can literally see a person's temporals that have been injured and it looks like a live wire. Like the activity is like that. Like it's like I just see it as like a live wire. I don't know how else to describe it. And when you use something like a lithium supplement or a lamotrigine, which now I'm getting into more, medications, but they can go a long way. And oftentimes you don't need much to help calm that area. But we're talking treating symptoms. If we're talking about really healing that area, your number one player, who wants to guess? For supplements.
Fish oil?
Yes, ma'am.
Wow.
DHA and EPA, because all of those neurons, that whole electrical network, it depends on fatty acids. Yeah. So you need those good fatty acids, what we call omega-3s, not omega-6s. Okay, not your inflammatory fats. You want the right proportion. It needs to be in balance. That helps with healing. The other major healing tool, oxygen.
Hyperbaric chambers.
Hyperbaric chambers. We use hyperbaric chambers for every other wound except for the invisible one in the brain. Gets on my last clinical nerve. Because if you're in the hospital and I have diabetes and I have to get my leg cut off, or I have gangrene, or I'm a burn victim and you've now given me a skin transfer and it's infected and not healing, what do they give you in the hospital? I don't know.
Hyperbarics. Wow.
Yes.
Really?
I mean, hyperbarics is standard of medicine for just about every wound except for this one.
So hyperbarics, I only knew before when I worked at the VA that they would put spinal cord injuries in a hyperbaric before there was any kind of surgery, right? Because they're like, if something's going to save this person's ability to have function,
I'll wait.
It'll be the hyperbaric, right?
Yeah.
Yeah. So it's
The
interesting
what,
for the
what
spinal,
injury?
spinal cord.
What injury? Oh, okay. I think that's the central nervous system. I don't know.
Right. That's why.
So it hurts works for the spine, but not the brain.
Not the brain,
Okay.
apparently. But this is what I don't get. Like, these are things that really could help people, that can save people's lives,
100%.
marriages, father-daughter, mother-daughter relationships. I mean,
Yeah.
everything. And yet the access to care is so limited.
Yeah.
Non-existent.
Yeah.
It's not even approved as the care model, the treatment model. So that's where you get into the nuances of why haven't we approved it? We need more studies. I'm going to say that, okay? But studies done thus far shows that oxygen heals, and we already know that from using it with other areas of injury. So, and I mean the most extreme injuries, which is why I mentioned a burn victim or somebody with gangrene.
Right.
That's not no mild staph infection, okay? So if I'm giving you oxygen for the worst of tissue injury, why wouldn't I offer that to you? I learned from one of the NFL players that I work with that they offer them hyperbarics if they have another type of injury.
Oh, wow.
Like if they are out for ACL repair, they get in the hyperbarics. But if you have a concussion, no, that's not part of the protocol.
Wow.
I mean, I know we like to say that Miami, we had our own Super Bowl with University of Miami playing, what was the other team? I forgot the other team.
I don't know.
But he's he's a Miami guy too, the quarterback. But I was watching this game and I saw him get hit in the face and there was blood coming out of his mouth. And the first thing I thought was his brain. Yeah.
I saw a player last week who has early signs of dementia. He played, I want to say, in the early 90s. Had no idea. Like, talking to these guys and talking to them about, well, what do they tell you about concussions? So you know what he told me? How back then, when he knew he could get back in, 3-finger rule. Can you see 3 fingers?
Yeah.
Get back out there. That's what he said.
Wow.
And I was just like, this is insanity. I mean, now they have different concussion protocols, but I think if you have to really be honest and say, listen, helmets prevent skull fractures.
Right.
That's it.
Not what's inside because of what you described before.
Correct.
About
This
your brain.
soft, like the consistency of butter, rocking and rolling inside. So if you're only protecting yourself from skull fractures for the most part, the bottom line is this: it does not prevent concussions, and we need to make sure that people make informed decisions. So this is where I get to ethics, because if I'm going to engage in a sport, I talked to one player. He understands everything. Now he said, "I'm not gonna lie, I still would have played."
Right.
He said, "I love football. I would do it again."
Absolutely.
So, but that's your choice.
Yeah.
Right. But you have others who are like, if I had known that having 3 concussions 20 years ago could increase my risk for dementia, I would have did something else. So it's important for us ethically to tell the risk. It's the same way if I'm prescribing a medication. It could help with this. It might not help with that. Let the person make their choice.
Yeah.
Instead of telling them anything that's misleading.
Correct.
Question, and we're going to turn to what we can actually do to help, because I think that's part of what we do on our podcast is give tools.
Yeah.
But what if somebody really loves the game and they want to play and they understand the issues with concussion? Could they, on the off season, or if they do experience, could they do like some kind of protocol like hypobarics, omegas, and really work on sustaining brain health when they're not playing, let's say, like on the off season?
For sure. Or just at home.
Yeah.
That is what I provide with any client that I see that has had head injury from car accident, sports related, like I said, domestic violence, all the things. You equip them with the tools to prevent ongoing cellular compromise. So you can get a hyperbaric oxygen chamber for your house. If it's within your budget, they're sold. You can have it there to use just proactively, an hour a day. I mean, it works wonders. Everybody may not have access to that, but those are things that you can do. You can really, really focus on a keto diet. You can make sure you're getting your avocados and your good fats and all of that. even if you're not able to, let's say, acquire a soft chamber for your house, exercise, anything that is going to improve oxygen flow to the brain. So think HIIT workouts or things of that nature where we're really, really getting oxygenation. Another big thing is just eliminating toxins. If I already have a brain that's been in any way injured, I want to minimize my toxin exposure, and it's toxins all around. Get in that sauna, sweat it out. There are tons of just daily practices that are very practical and very accessible that people can implement if they understand first how their body works.
Yeah.
Then they'll understand why these modalities will help prevent ongoing issues. It's really inflammation too. Anytime you have an injury, just think of a sore. It's swollen, it's got white cells and pus coming out, all of the whole immune reaction. Well, imagine that happening in your brain. You've got inflammation. So what helps to decrease that inflammation? Anti-inflammatory supplements like curcumin, right? Think of your just natural things you can go to decrease inflammation in the brain, because that prolonged inflammation causes ongoing cellular breakdown, damage, protein buildup, tau proteins. And now you're in your 60s and you're struggling to remember things. That's scary. I mean,
That's so scary.
I've seen some people that have cried, very young, retired athletes that are like, I had no idea that this is what was happening.
And again, I really checked out like yesterday.
No, you kind of just inspired me. Let's go.
And I was like, I realized, I'm like, oh my God, I fell a couple of years ago. This was like within the past 5 years. I was snowboarding for one of the first times, and I fell and I hit my head like this.
See?
Really bad, and that's so bad that I just had to lay there for a second because I was like, I might be like actually injured, and I'm not sure. So, but then I eventually got up and I was like, I'm done with this. I'm not.
You did that needless to say, 1, 2, 3.
I did not get back on a snowboard. Again, I took up skiing. I'm trying better. But I'm like realizing, I'm like, oh my God, and I hit my head really hard.
Yeah. And even guess what? Everybody can't go out and get a scan.
Yeah.
So even it just knowing. Now we can just implement, just treat as though, I mean, once you see it, you're, oh, there it is. Yep. I knew I hit my head. But you're still going to start to implement the same. So for your clients to keep it, cost effective and not having people run out and spend a bunch of money, if they're not able to get imaging, it's the thorough history. It's you educating them that if you've hit your head, that could be a huge part of your clinical presentation. Yes, it's difficult to tease out. I've got a good one for you.
Okay.
A client in Chicago, which is Chi-Town, where I'm originally from.
Shout out Chicago.
Yes. A client in Chicago. So this is her husband. He had a major motor vehicle accident that we know caused a more moderate to severe TBI, but he's also survived childhood sexual trauma and is struggling with a lot of emotional dysregulation. And so she's asking me, which one is it? Like, is this still his TBI or is this? And I'm like, I don't know. We won't know if we don't take a picture. So in that type of a scenario, it would be a great tool to say, okay, are we talking about frontal lobe, no impulse control here? Are your temporals really struggling? Or when we look at functional brain imaging, we're also able to better evaluate those core, deeply seated limbic areas and to see how they're showing up. There are different patterns that we can see that are consistent with more of a PTSD picture. And so again, we're talking about where do we cross over from analyzing behavior to getting the underlying data of why that behavior is presenting? Because a person having severe depression, temper outbursts, isolation, struggling with relationships, it can all look the same.
Right.
But you may not know what major brain system is stemming from. And that makes your treatment altogether different. So for this individual, he couldn't run out and get a scan. But I did link him with EMDR. I said, well, let's start there.
Yeah.
We'll have to do process of elimination at this point. But treat both.
All right. So we want to ask you a few quick questions. and then we'll see where we go from there.
I would say processing speed and what can look like ADHD.
One supplement that somebody who's struggling with a TBI or potential TBI could add to their daily routine that will help their brain.
Lithium orotate, life extension, 10,000 micrograms twice a day, and omega-3 fatty acids.
What is the biggest myth in psychiatry when it comes to TBIs?
That how a person presents mentally has nothing to do with their underlying brain health. Brain health is mental health.
Thank you.
And the mind and body are not separate. They never were.
Yeah.
Okay.
What do you think Jesus would say about psychiatry, brain imaging, and everything of that sort?
Jesus would say, look at the organ you treat. The end. Yes.
It has been such a pleasure
Yeah,
to
this
have
has
you
been
here.
amazing.
Yes,
Thank you so much for coming and sharing.
We're
Yeah.
so happy you came.
I'm
And
happy you had me.
you will find all of Dr. Getting's information linked in the show notes in case you want to
Yes.
book an
come
appointment
see
with
me.
her. Yes.
Teach your brain.
We highly recommend. And as always, if you like this episode,
Like, comment,
subscribe. We're so in sync. Till next time, guys. Bye.
bye.
Well, friends, thank you for tuning in, and remember, freedom is possible. Join us next time at Eden's Table, where you can always sit with us.